We'll go to the first item, which is the briefing, and it's an update on council resolution regarding shelter capacity and navigation services. I'll recognize the manager.
So the item is on in your backup, and I think Diana is going to walk us through it, and then we'll then have questions about this presentation to see how we might answer additional questions that might arise. Diana?
Thank you. Good morning, Mayor and Council. Today we're going to be giving an update briefing on our community-wide shelter assessment. You may recall that in August of 2022, Council approved emergency contracts for new providers to operate the Arch and Southbridge shelter. At that time, Council gave direction to HSD to perform an assessment of our emergency shelter system community-wide. I think it's important to say, and you'll probably hear this echoed throughout the briefing, that the city does not control the entire shelter system. We are an owner of significant shelter facilities and a major funder, but by far not the only player, nor should we be. And so the recommendations that come out of this assessment really are about our entire shelter system. Some of them are immediately actionable by the city. Most of them require partnership with our other stakeholders in the system and potentially other funders as well. So the timing here is important because Council also asked us to do this before we resolicited the emergency contracts. So we are looking forward to doing that RFP process, but we'll be wrapping this assessment up before moving on to that process with learnings in hand and thinking about how we can improve the contracting process as well. There are a couple of pieces of related direction from Council that really are woven into this briefing today, but that we will be responding fully under sort of separate memo and report to Council. And those include a February resolution that asked staff to look at all extreme weather sheltering. That then is really responsibility that crosses both the homeless response system and Homeland Security and Emergency Management. You have had an interim update from HESM last month, and we will be looking to provide a full update on that, I believe, in November. And then next, last month, there was a resolution that asked us to ensure that as part of our shelter assessment, or in addition to the ongoing shelter assessment, we look specifically at geographic dispersion of our shelter resources compared to the unsheltered population and the location of those folks, as well as providing some cost estimates for operations of shelter and capital. So as staff began to look at doing a broad assessment of our community shelter system, we really took a multi-pronged approach in terms of the information and research that staff undertook. Certainly looking at national best practices, evidence-based practices and research, leaning on some previous consultant reports that had been performed here in Austin specific to our homeless response system and our shelter. Staff spent significant time looking at peer cities' shelter systems. And then, of course, we dove into our local data, coming primarily from our homeless management information system to understand how our local system is working. Finally, significant direct engagement with a wide variety of stakeholders, including people experiencing homelessness who are either users of shelter or may not be using shelter and have had some experience in the past, our direct service providers, and then other advocates and service providers in the space who may not be actual shelter providers. So I think high-level findings of our research indicate, first of all, top line, I think, is that we only have one shelter bed for about every 5 people experiencing homelessness in our community. So that, of course, is a major contributor to our significant unsheltered population. In fiscal year 22, almost 3,000 individuals utilized shelter services in Austin. And when we look at the beds that were online, we had an average of about a 92% utilization rate of the available beds in the community. The average shelter stay is 115 days, regardless of exit type. I will say that when we look at the data, we see some bifurcation here. People who exit shelter without a known housing destination tend to have shorter stays. People who eventually move into housing, the average stay is a bit longer, which does make sense. They remain engaged in services. It takes us a while to get them housed, but typically that stay is longer than 115 days. And in our experience, particularly in the city-operated bridge shelters, we have seen that timeline extend because the housing search is so difficult. And then finally, I think we have a substantial population of folks in shelter who are experiencing chronic homelessness. That means they have been homeless for over a year or 4 times over the past 3 years, and importantly, are living with a disability that creates another barrier for them in terms of housing stability. So I think one of the really important things for us to be tracking as a community is what our outcomes are out of shelter. And the way that we do that is that we look at shelter exits, so all of the households exiting shelter over the course of a year. And the high-level news here is that over 50% are exiting to known permanent housing locations. I believe our math there is about 46%, or 56%, excuse me. 12% we know return to the streets, or they may enter an institution that could be a hospital, a nursing home, or maybe facing incarceration. And so those are not the outcomes we want to see. But I think importantly here, you'll see that we do have a substantial number of people where the destination is unknown. So it's not atypical for someone to spend some time in shelter and then not return. And I think that, we believe that this 31% unknown destination really is a combination of people who self-resolve and really would like to leave their shelter experience behind, and so they don't report back where their destination is, and people who are returning to homelessness. It will be an ongoing challenge for us to improve the data on this front, but that's something that we and our partners will continue to work toward to understand better what happens here for those people where the destination is unknown at the time of exit. So when we talk about Austin's shelter portfolio, we are talking about just south of 900 beds. In May of this year, we had 880 active beds. Remember that is post-closure of the downtown shelter owned by Salvation Army, but before we began the expansion of shelter beds in our existing bridge shelters, for example, so we thought that was an important baseline. The city owns 300, or owned at this time, 333 beds, so 38% of the shelter capacity. With the remainder being owned by our private nonprofit partners. As we look at the portfolio, we see that about 47% of beds are set aside for families with children. That population is about 25% of our population of people experiencing homelessness, but the overrepresentation or the richer resourcing of that part of the system makes sense because obviously we really don't want children to be facing unsheltered homelessness. However, when we look at the balance of single adults, one of the things that we note is that we don't have a lot of beds that are just open for any single individuals. For the most part, they are defined by gender. We've got 13% that are adult men only. We've got only 1% that are available specifically for women, a significant portion in our bridge shelters that do take either gender and no other requirements, but they are set aside for the HEAL initiative. And so we really do see a gap in just beds that are available for folks, for referral, not based on specific programs or specific populations. 12% of our beds are dedicated to persons fleeing domestic violence or other victims of violence. And then we have, of course, other special populations like youth, veterans, immigrants, refugee, and some medical respite. Those are all important subpopulations. We'll talk about that a little bit more in a moment, but I think we want a balance of generally available beds and those more specified programs. So we know that we had about 880 beds, and the question is, how many beds does the community need in a perfect world? And for this, we rely on a report that was completed in 2020 by Barb Poppy and Associates that looked at our entire homeless response system and said, if the system were right-sized and functioning sort of at peak efficiency, what would you need in each of these intervention areas? Based on that and adjusting for population growth since 2020, we estimate that by the end of 2025, we would need just over 1,500 beds in the community, and that 1,428 of those should be for single individuals, 91 for families with children. Now, those are households, not beds, so more beds than 91. And so what that means is if we need 1,428 beds for single individuals, and we've got 466 right now, that gives us a gap of almost 1,000 beds that would need to be in place by the end of 2025, again, for an ideally functioning system. And I think it's important also that that ideally functioning system is really predicated on having sufficient resources across the board in permanent housing, in prevention, et cetera, so that we're decreasing the number of people who are just sitting waiting for housing and decreasing the number of people who fall into homelessness and might need shelter services. So we have begun, and I believe it was May 12th, Council received a memo from the manager talking about our efforts to expand shelter in the short and medium term. And so we do have 3 projects that are already under development. Northbridge, we have expanded to double occupancy. That is complete. We are in the process of expanding to double occupancy in rooms at Southbridge. And you may know that Esperanza Community is in the process of creating micro shelters at their site. As of May, they had 85 of an anticipated 200 beds. So we will continue to see them expand. When we look at those projects against the gap that we've identified for single individuals, we still need about 700 beds. And so I do want to note that in the face of this very significant gap, understanding that it will take time for additional beds to be added to the system on a permanent basis, the city has done a couple of things to provide some relief. One is restoring capacity at the downtown shelter, the formerly operated and currently owned by the Salvation Army. So council approved that on June 8th. Urban Alchemy will be operating that site for approximately a year for 150 beds. And then council has before it on Thursday an agenda item to stand up the marshalling yard as a temporary sheltering facility with 300 beds. When we look at the geographic dispersion of shelter, this map combines, the blue dots are the locations of our shelters, both city-owned and those owned by private nonprofits. And it is a heat map of where unsheltered individuals were found during the point-in-time count in January of 2023. And so you can see that our shelter resources are concentrated in sort of along the I-35 corridor in downtown and in the Eastern Crescent. And while we will, in our report, give more detailed analysis by geographic area, I think that what this visual tells us is we have a significant concentration in South Austin, south of, around and south of 71, and no shelter there. And we have a significant concentration along the I-35 corridor, north of 183, and in Northwest Austin as well, with no shelters in those areas. And so Geographic area is certainly not the only consideration that we look at when we look at siting shelter, but as we look at expanding our permanent shelter capacity as a city and with our partners, this certainly needs to be one of the things that we take into consideration. The final thing I'll note here, in June, ECHO briefed the Public Health Committee on the point-in-time count and some trends that they're seeing in the numbers. And one of those trends was, while we still obviously have a very significant concentration of individuals in Central Austin and in the Central Business District, that concentration has diminished, and we have seen movement into other parts of town. So we have top 10 recommendations. And again, as I said, there are some of these that are actionable by staff, but most of these really are going to take a number of partners and likely a number of funding sources to bring to fruition. So we're recommending that over the next 2.5 years, the community look at adding 1,000 shelter beds for single individuals, because that's where the gap is. And we think that at least 80% of those should be really general population. So not specified for a subpopulation for a particular program. But we do have some significant gaps for subpopulations. We have heard for some time that our citizens in the LGBTQIA community have a lot of difficulty in our existing shelters and often don't have all of their needs met. We know that we have folks with significantly complex health needs that can be difficult to meet in a general shelter environment. So those are a couple, not the only subpopulations. I would also add, particularly with the loss of the Salvation Army downtown, specific beds for women. We would like to see in every shelter in our community diversion and rapid exit programming. And what that is, you know that we work very hard on our long-term housing programs. So rapid rehousing, which is time limited but substantial support and case management, and permanent supportive housing, which is not time limited. But there are many individuals and households that come into shelter based on a precipitating event. They do need help to get back into housing, but they may not need that to be long-term. So it is really often how this is structured is it's a pretty flexible pot of funds where case managers on site can problem solve with folks entering shelter and hopefully move them back into housing quickly. Notably, we need to diversify our funding streams in this space. As we look at our peer cities, I will say that Austin's investment of general fund in shelter operations is significantly higher than we see in other communities where the philanthropic community plays a much more significant role in the ongoing support of shelter. So I think we have an invitation to make of our partners in the community to come shoulder to shoulder in this work to provide the capacity that's needed. And then finally, when we look at how and what we expand, much of our work engaging directly with people experiencing homelessness indicated a preference for something other than just purely congregate shelter of everyone in one room. So actually the most preferred model was with a roommate. So in a room with a roommate, potentially 2 to 3 people, with being alone in a room being the second most favored model, and then of course congregate less favored. So those are issues that really are going to take a lot of partners and funders. There are other system improvements that we think can be achieved in close partnership with our continuum of care governance structure, which is administered by ECHO and has stakeholders from across the system. We believe that we need baseline written standards for shelter in our community, as well as best practice recommendations. We would like to see a system-wide policy and process for involuntary exit of clients with some appeals process that's community-wide. We want to increase opportunities for collaboration and, in particular, invest in ongoing training of frontline staff in shelters. You can imagine that this is it's a difficult job. And there is substantial turnover, and so we need to be constantly investing in staff so that they're equipped to manage the shelters well and feel supported in that space. Finally, with ECHO and the continuum of care, we'd like to enhance the use of standardized performance measures. We do have some right now, but just as an example, ECHO has been working for some time in partnership with HSD on a scorecard for all of our rapid rehousing programs that's shared across programs regardless of funding. We'd like to see that for shelter. Finally, within APH and the Homeless Strategy Division, a couple of recommendations that we would like to begin to move on immediately are establishing coordinated shelter referral and access process. Right now, pretty much all shelters individually have their own referral waiting list or access. So that makes it really difficult when, say, our outreach teams, host team become aware of someone with very significant needs to know. We'd have to kind of call each shelter to identify where that vacancy is. And so that also implies that we need to maximize technology and implement a bed management tool, at least for the city-owned and funded shelters, where, of course, we have significant influence. We'd also like to see a common intake assessment for those shelters. Finally, as the continuum of care and ECHO develop written standards, we'll be really following on that process to assess which of those standards can be incorporated into our contracting process. That's been a really important way for us to provide that sort of alignment with our overall system so that we are affirming the standards that are established by ECHO and the COC, always looking to ensure that that's feasible within the legal framework of our procurement process, et cetera. Having ended on perhaps the least interesting part of this, which is procurement, I will pause there and welcome any questions that you have.
Let me make just some final comments on this, because I think there's not an issue that has been more prominent on the council's agenda than homelessness. When you look at what we've done over the last 4 years, we spent a considerable sum of money, unofficially over $200 million, to try to deal with the issues of people who are experiencing homelessness. And at the end of that period, we haven't decreased the amount of people experiencing homelessness. In fact, it's increased. And so what we've got to do this course of this next fiscal year, and I know we're going to get into the discussion of budgets, and because I think that's the policy questions that we need to kind of wrestle with, is one of the things that I would ask the council to think about as you think about this issue, a very important issue for our community, is to take a step back and think about the governance process. The city, as an outsider looking in, when I was a private citizen, it looked as if the city owned this issue in its totality, when in fact just a few short months here, it's clearly a multi-jurisdictional issue. It involves the county, it involves Central Health, it involves the city of Austin, it involves the Veterans Administration, and a host of other private partners that we absolutely need to lean on to help us address the issue of homelessness. And we need metrics that then we are driving to try to achieve for the public expenditures. These are the results that we're driving for. And I hope that as we enter into that discussion during the course of the next month or so, that we can kind of focus on that, because the success of this isn't an input, it's an output. And right now, as near as I can tell, the success has been measured by an appropriation, and that's just the beginning. It's really the beginning of a long program to try to achieve results. And I just wanted to give my editorial thoughts to that, even though I'm not supposed to be an editorial writer, and answer for the council to ask questions.
All right, we'll open up for questions. Councilmember Poole.
City Manager, thanks for those centering comments. I completely agree. I've been disappointed that the philanthropic and private sector haven't stepped up. We certainly have, in the way that we had anticipated. We had certainly pressed and pushed and exhorted and advocated for their financial support. So maybe in a new year, we can press even harder on that. So I'm with you on that. I have two specific questions from the slides. One on that heat map, which is a great slide. Yeah, that was it there. I'm curious if you can tell us two things about that, the type of housing at each site, and if you can't, send us a memo with the information, the type of housing that is there, because we have different categories of needs that we address, and if it's all mixed, let us know.
Yeah.
And then the second question is, how many beds, how many people are sleeping in those sites?
Sure.
On average?
So this map, and I'm glad you offered the opportunity for clarification, is of shelter beds only. Mm-hmm. It is not of permanent housing location. So it's really just looking at shelter beds. Because of the number, we can certainly provide, and I do want to clarify, we will be following up both with a narrative report of the shelter assessment and a specific response to the resolution that came last month that asked us to do this work. So we'll provide some additional detail. We can certainly identify each of those shelters with their capacity, et cetera. And we have a variety of units of analysis we can utilize for the number of people. And so we'll look at that. The resolution did ask us to look at it by council district, but we also think there are other potentially even more meaningful geographic sort of levels of analysis, whether that's zip code, et cetera, and we can provide the point in time number that came out of the ECHO's report.
Okay. Thank you for that. That'll be useful information. The city manager mentioned Central Health. And I'd like to dig into that a little bit more if I could, or just ask the question, what role Central Health currently plays in this work? What role do we think Central Health should play? What conversations are we having with Central Health? My thesis is that Central Health needs to be leading in this effort, not the city of Austin.
Sure. So, go ahead, sir.
Yeah, Councilmember, I think the issue of, to the degree that health is part of the issue or part of the formula that's needed to help people escape the experience of homelessness, Central Health will play a critical and key role, especially for the poor and the vulnerable. And there's no question that these individuals are either poor or they're vulnerable. Even though it's anecdotal, because I don't have statistics that can tell you the number of people, though others may have this, that experience behavioral health issues, that where they need intensive therapy to help them become part of our citizenry that can be a full productive citizen within our community. Those are things that Central Health can and should play a role in. But what I will say is that in their defense, we've not, that's why I asked us to start thinking about stepping back to find out the right role, the right lane for each agency, the city being one of them. Because I don't think we want to shirk our responsibilities either. But I think they do play a role, and I think part of that is we need to extend at least that request for them to join all of us in trying to address the various components and lanes that they own or part of because of their public responsibility or their private responsibility because they're private not-for-profits. And we'll intend to do that.
I think that is terrific, and that would be a good aim and hopefully a successful goal for this year and going forward. Central Health has health in its name. I agree the city of Austin should continue to do the supporting and organizing work and being actively involved, but I really would like to see a larger role played by Central Health.
So I would like to give a couple of examples which I think are promising sort of examples of the way that we can work together and things that Central Health has on deck. So Central Health has approved the issuance of certificates of obligation to create a facility for 50 respite beds, and that's essentially specialized shelter for individuals with complex health needs, including those who may be being discharged from local hospitals and need a place to recover, but not necessarily limited to those individuals. And they have been funding some of that from an operational standpoint for some time. So I think this is, potentially that is one of these, this gap of beds that we have. We're still, I think, in the fairly early planning stages and want to work with them to understand the timeline. The second piece is that we have, in the coming months, will be issuing an RFP for something called the At Home Initiative, which is services for permanent supportive housing. It is an evolution of a Pay for Success program that some of you may recall. And that the sort of important piece of that initiative is that it is multi-funder. So it has the city, it has the county, it has Central Health as a partner, as well as private partners like the St. David's Foundation. And the way that Central Health will be participating in that partnership is that for PSH units, they will have mobile medical teams that are available and visit those sites. So that the other, you'll have a general case manager, et cetera, but it really is an operational partnership that does lean into their expertise as a healthcare funder and provider. And so those certainly aren't the only ways that I hope we can partner, but I think those are important early steps.
That sounds great.
Thank you.
Keep us posted. Thank you.
Thank you. I'll go Councilmember Fuentes, Cadre, and then Harper Madison.
Thank you, Ms. Gray. And Councilmember Pohl, I echo your sentiments in wanting to hear more from Central Health, and perhaps we can invite them to our next Public Health Committee meeting to do a specialized presentation on their efforts regarding homelessness. So just wanted to throw that out there. Ms. Gray, one of the items that you presented on, and I just want to thank you for your presentation. I think you do a fantastic job with your presentations, and I appreciate how you format the information and how you really cover all of the areas in which I as a council member, would be looking to learn more about. So thank you for the presentation. You talked about the gap for non-referrals services within our shelter system. That is an issue, colleagues, that I have seen happen many times, is that and you have to be on a referral list to get into one of our, not only one of our shelters, but a shelter in the city. So what more can we be looking at, or can you just elaborate on what that might look like for us as we explore options in providing emergency shelter that is non-referral based?
Sure. And so I think there are a couple of pieces here. You could have walk-up shelter, right? And really, in some ways, that is what's happening. But understand that now, and even when, if presuming we expand, we probably will have some frank shortage of shelter beds. And so we do need to be really strategic about how we refer folks into shelter. And I'll just give you an example. It's not uncommon that we have street outreach teams come across people in the field that have significant vulnerabilities, whether those are healthcare related or related to potential victimization, et cetera. We do want to move those people into shelter if that's an appropriate placement for them. And again, this is probably what you've experienced. You then are faced with calling multiple shelters to try to understand. And so staff is working on this now, potential models, but let me give an example of something we have done in the past that I think was useful. You will recall that during the heated days of COVID, we had several protective lodges up, and 5, and for a total of about 350 beds. And those were intended for people with significant healthcare vulnerabilities. To COVID, it was pre-vaccine, et cetera. And so the idea was that it was providing a safe place for people to socially distance. There was a lot of need, and so we had a bed management team. And that bed management team was sort of multi-partner. It consisted of city, community care clinics, particularly the Healthcare for the Homeless clinic, our community health paramedics who engaged a lot of these folks in the field, as well as ECHO. And so I think at least for city-owned properties and likely for city-funded properties, I think saying we really need at least a coordinated system where, as need arises, we're able to identify the best placement and know across the system where our capacity lies.
And with that effort in mind, knowing that is a need for us to have a coordinated system with bed management, is that something that your division will be working on implementing, or do you need additional guidance from council or resources as we approach the budget season?
It is one of the recommendations we have that we believe is actionable without action from council at this time. We may have some cost associated with the system, but I think we want to spend some time understanding what the recommended system is before we get to the point of resources.
Okay. And the other area I wanted to hone in on is the utilization of our shelters. One thing that struck me during the point-in-time presentation that we received from ECHO a few months ago was that on the day of the point-in-time count, the utilization rate of our emergency shelters at that time was around 70%. Now, you presented, I think, a higher number than that, and so I just wanted to, if you could just share, what are some of the factors that
Yes, and thank you for that, but it's because we would like to clarify that. We also were concerned by that number, and so staff spent some significant time with ECHO really combing through that data. And what we found is that we had a couple of providers that had beds entirely offline. So because of funding, because they were moving location, et cetera, those beds were not available to be filled at the time of the point-in-time count, which meant that our denominator was off. So of the beds that were available to be occupied at point in time, 92% were filled.
Okay, that's an important clarification.
Yes.
Because I've been sharing back to the community, and as we invest so heavily in the marshalling yard as an emergency temporary shelter space, I think understanding that they are being utilized quite heavily, 92%.
Yes, ma'am.
That is a strategy worth investing in, and one that, as you've shared, that we need to expand our options. That, I believe, covers my questions. Thank you.
Thank you, Councilmember. Councilmember Caudry, then Harper Madison, then Kelly.
Great, thank you, Mayor. And then I think Councilmember Reinholter. So some of my questions, I think you've already kind of answered, so that shows you how great of a presentation you did. But I wanted to kind of touch on the underserved populations. You talked about, single adults, families, refugees, members of the LGBTQIA plus community. What resources are there currently for example, refugees, right, who might have gone through so much hardship to come to this country, now they find themselves in the predicament of homelessness? There might be a language gap. They might be suffering from a level of, PTSD. What resources are there for that community? And then my second question on this topic, when it comes to the LGBTQ community, I've gone to several shelters in my time in office, and I've seen residents of those shelters at times say, some very unfortunately transphobic language towards other members of that shelter. So are there any resources for our trans Austinites who might find themselves unhoused?
Sure. So in terms of the refugee and immigrant population, I'll draw your attention to, let me actually get to the right slide here. Casa Marianella is our primary service provider that really focuses on that population, and they have a combined 77 beds. So that is the resource that is targeted to that population. In terms of LGBTQIA and particularly trans population, right now we don't have publicly funded set-aside beds for the population. I am aware of at least one sort of community-based, very small grassroots shelter.
Is that Queertopia?
Yes, sir.
Yeah.
And so, that is run out of, I believe, a single-family house or a duplex or something like that. So those exist, but again, within our sort of overall system and certainly receiving public support, that doesn't exist. And I think we're not meeting the need in terms of volume of the population.
Got it. And then I had a question on the heat map about geographic regions. I think you highlighted where folks are and how they're kind of spreading to other parts of the city. Do we know why folks are kind of dispersing, and then do we have a number of what the count looks like, or like a rough estimate of sorts?
Sure. So let us provide that. We'll provide that, I think, in the memo, the specific number by geographic area. But I think it was a confluence of events. First of all, during the pandemic, resources were really not available in the downtown core in the same way they had been historically. both the decriminalization of public camping and the reinstitution of prohibitions on public camping have induced movement of the population. When camping was not a misdemeanor, people came out of sort of more removed areas, and we have seen since May of 21 and I guess August, September, when we really implemented, those populations move out from more visible areas, and in many cases into the woods. We've seen an increase in population, for example, in our parklands since that time. So those are two, not the only, I'm sure, but two significant drivers.
Got it. And then my last question, it's on the marshalling yard. Will the marshalling yard have any diversion services, rapid exit, and coordinated assessment the day that it opens?
Coordinated assessment is a required service under the scope of work. Diversion and rapid exit were not required services under the RFP, but we are talking with both the recommended vendor and our partners at ECHO, who have a pot of rapid exit and diversion funds available that they have indicated they can be available to endeavors should they be approved as the operator. And they will have case management that can provide that. I think you point to coordinated entry as potentially an operational challenge. And the operational challenge is that it takes a while for assessors to get credentialed through our system. And because Endeavors has not been, had staff who are coordinated assessors previously, we need to work through how long it will take them. I will just commit to you that we will work both with the vendor and with, we do have some city staff who are certified coordinated assessors. We'll make sure that those services are available.
Great, thank you. And I'm sorry, one last question. How much ARPA funding is left over? Do we have a number?
How much ARPA funding is?
Left over.
We currently have, I believe, 3.6 approximately. That is unencumbered.
Got it.
Assuming, let me give the caveat, assuming that marshalling yard passes on Thursday, and that's 9.14.
Great, okay, thank you.
Thank you. Councilmember Harper Madison, then Councilmember Kelly, then Councilmember Ryan Alter.
Thank you for recognizing me, Mayor, and thank you for your effort. We've been doing this for several years now, and I don't envy your position. I know it is extraordinarily difficult, and I just like to make sure to express my gratitude for your dedication and your hard work on something that's really a difficult task.
You're very kind, Councilmember.
Thank you. I appreciate you. I think most of my questions have been answered, with the exception of I'm receiving some concerns from constituents about sort of a general lack of transparency about how we're going to apply those $9 million. And I received a specific concern about logistics, how we're getting people to and from the marshalling yard. And then what does the shelter situation look like? Are we putting people in tents? Are we, like Esperanza, for example, they're working with an organization that we found out of Boston. They do this plug-in house option. I think I've introduced that to you before.
Yes.
And so what does the lodging look like logistically? How are we getting people to and from? And how much clarity can we get around how we're going to apply that $9 million?
Yes, ma'am. So I hear three separate questions. I want to make sure I answer all of them. One is about process. The second is about transportation. And the third is about sort of the format of the shelter. So we did an RFP. There is a scope of work that the vendors were required to respond to. I believe that has been provided or will be provided today through the Q&A process. And so that really details with quite a bit of specificity what the on-site services are expected to be. Past that threshold expectation, of course, a vendor can do more and bring additional services. And so there was a competitive process, and Endeavors was the highest scoring offerer. In terms of the physical configuration, the marshaling yard is a large warehouse facility, so everything will be, all of the beds will be interior. We are working with Endeavors, in fact, today even, to help understand what their preferred layout is, but we will be bringing in additional resources in the form of shower trailers, bathroom trailers. We'll make sure that there's a laundry service. And of course, there will be some common areas and areas for staff and case management services, but all within the marshaling yard building proper, with the exception of, again, as I mentioned, some of the hygiene trailers. And then finally, we did require within the RFP acknowledging that the site is close to, but from a walking standpoint, a little bit of distance from the closest bus stop, and wanting to ensure that we're good neighbors, we asked the offerers to provide a shuttle service that will operate from 8 a.m. to 8 p.m. at least. They can propose to us what the stops are, but the expectation is that that would include sort of major transportation nodes, 2 multiple bus stops, as well as places that people might typically go for services.
I guess as an extension of that, my question would be just about general privacy. If all the beds are in sort of a massive warehouse space, is there any sort of accommodation for offering folks some privacy?
So one of the options that we'll be discussing with Endeavors, and again, hearing their proposal, is that you can use pipe and drape. There are some potential, but we are dealing with limited space, right? We have to do that. And I think that in this instance, it was important that we meet some need of creating additional beds quickly. We had an unusual opportunity in terms of the marshaling yard being available. Again, as we look at our longer-term shelter options, obviously we'll be looking much more closely at what that configuration is for longer-term operations. This is a congregate shelter, but we do anticipate there will be some separation, certainly but by gender and those kind of things.
I appreciate that, and I would just like to echo Councilmember Kadri's sentiment around the trans community and some of the horror stories I've heard about their experience in congregate shelter. I just hope that there's some sort of consideration around security as well.
Absolutely.
Thank you.
Absolutely. And I will add, and this contract is also still under negotiation, so nothing is finalized, but remember that council has approved the operation of the former Salvation Army site downtown. One of the things that Urban Alchemy has talked about is doing something they have done quite effectively at the Arch, which is using some of the previous office spaces to create additional privacy and security, particularly for people who need it.
Thank you, Councilmember Harvard Madison. Councilmember Kelly, then Councilmember Ryan Alter.
Thank you, and thank you for this presentation. So on slide 3, you mentioned Peer Cities research, and I was real glad to see the District of Columbia there. I recently took a trip with the Chamber of Commerce and met with DC's Council Chairperson, Phil Mendelson, and we spoke at length about some of the things that they've done to address homelessness in DC that have been successful. So I was wondering if maybe you could elaborate just a little bit on some of the information that you found from that Peer City research that you've brought back to Austin that you found to be effective.
Sure, and much of this will be be shared in greater detail in the narrative report. It really varies, and so no one system is perfect. But in some cases, the strengths that we see are just sort of availability of beds. You have some communities that are right to shelter, where you have almost a 1-to-1 ratio. That comes with significant investment implications, as you can imagine. We see some communities where the referral process is very strong and seamless, which means that system is much more efficient. We see other communities where, for example, there's something like an ombudsman process so that if someone is exited involuntarily from shelter and they don't agree with the decision, they have additional recourse. And so I don't know that I'm prepared to go sort of community by community, council member, but I think plenty to learn from our peer cities, and we're hoping to replicate many of those best practices.
Thank you for elaborating on that just a little bit. Also, on the same slide, you list those 2 consultant reports that were done for the city of Austin, and I noticed they were done in 2020.
That's correct.
And so I guess my concern is that you do mention, we need additional shelter space and capacity, but since the reports were done in 2020, I question the relevance to our needs now, 3 years later, if it might be significantly more based on so much has happened. Could you maybe speak to that a little bit?
So as we look at, first of all, what we did with the Poppy report, because it was a forward-looking, it said, this is your right-sized system. It is not where we are today. We did take that and adjust for population growth. While we've had a lot of fluctuation in the visibility and location of encampments, our point-in-time numbers have remained relatively even. But I will acknowledge these are models that we will need to revisit over time. It is fundamentally difficult to have data analysis on a population that doesn't have an address. And so we will continue to revisit this with our partners at ECHO, but I think this is the most thorough analysis that had been done to date, and we think still is valid as a starting place for where we want to go in the short term.
Okay, thank you very much.
Thank you, Councilmember. Councilmember Ryan Alter, then Councilmember Allison Alter.
Thank you very much, Mayor. I just want to start off with a acknowledgement of something that you said about South Austin. South Austin is feeling this hard. If any of you, drive around down there and talk to anybody, it is in every conversation I have with somebody down there, this issue comes up. What are we doing about homelessness? Why is it getting worse? We need everybody's help. And that's not just here on the dais, to your point, the broader community. I also want to just kind of level set for a minute, just in the vein of, if we stop talking about it, we stop talking about it, right? The black population in our unsheltered homelessness, or in our homeless community, is 34%. 7.3% of Austinites are black. We have more Hispanic homeless individuals than we do white, yet we have 50% more white residents than we do Hispanic. We all know this. This is no surprise. But this issue is disproportionately, constantly affecting the marginalized communities, and that I feel like we have to keep saying it. I wanted to ask about something that the manager talked a little bit about, and that was the mental health aspect of what we're doing, particularly around substance use treatment. What services or what partnerships do we have available other than Integral Care to get, whether it's MAT, medication-assisted treatment, or just other, particularly substance use treatment, but other mental health treatments in the beds?
Yeah. So let me give a couple of examples and let you know I don't think this is exhaustive, because we have substance abuse treatment, of course, that happens in other divisions within APH generally. We have a MAT program within our community health paramedics who do tremendous work in the field of finding people and connecting them to medically assisted treatment. It's, probably not to scale. We know it's not. When we look at our shelter beds, there is a particular provider that focuses on substance use disorders and treatment, and that's a new entry. That is not the only population they serve, but they are equipped to provide recovery services, not detox, but treatment. It is a huge gap. And I think that this is one of those areas in which this is fundamentally a healthcare issue. And so we actually have some limitations on how the city can play in this space. But I absolutely think that, you know, it is not uncommon, particularly as someone stabilizes, whether in shelter or in permanent housing, to say, now I'm ready for treatment. And too often the answer is, it's going to take a while to get a bed.
Yeah. In that vein, and this might be more of an echo question than you, but what kind of outcomes data do we keep in terms of our specific shelters to understand which shelters are, you know, excelling, if dare I use, you know, where do we see success?
Sure. So any publicly funded shelter, or I should say city-funded shelter, ECHO, the Continuum of Care program that comes through ECHO does not fund shelter, so we are the primary right now public funder, although not the only one, is required to participate in the Homeless Management Information System, which is our shared database. And there are universal data elements. So we know how long someone was there, what the rate of involuntary exit was, again, with the caveat that we have a substantial number of exits where we don't necessarily know what their destination was. And so we do have, I think, a solid baseline of shared data that we can utilize. Amongst our recommendations is that we get really specific about what are the key indicators for these shelters, and that we do just that we really begin to look shelter by shelter. And that's certainly for city-owned or, you know, largely supported shelters where we see a gap in performance. We need to be intervening with that vendor and making sure that we're providing the best quality service we can.
And when we talk about performance, is that just getting into housing, or what is a
I think
positive outcome?
there are multiple metrics here. Certainly getting into housing, but acknowledging that the shelter providers aren't necessarily the permanent housing providers, and that we use a prioritization system in our community, which may mean that someone is relatively low on the list, right, for getting into housing. That's why that flexible pool of funds is so important. If someone's not going to get RAPID or PSH for some time, we want staff on site to really have some flexible funds to work with them. I think the rate of involuntary exit is really important, right? These are complex situations. People are living with complex conditions. But as much as possible, we want to keep people stable in shelter until they are housed. Where we see very high rates of involuntary exit, we're concerned about us not doing as good a job as possible in those spaces.
Okay. Which of our shelters require, we talk about low barrier versus high barrier. Which of our shelters require you to have some form of detox or I know like at the Arch you can't use in the Arch, but they say, you know, kind of what happens outside their doors is what happens outside their doors.
Correct. I think that, and so I think we would need to look at that. Obviously, a new entry, because it's a recovery space, has rules certainly not only about not suggesting everyone has to be completely abstinent, but you can't be under the influence on site. And I think that is likely sort of a bar that we could have in some of the other shelters. I would want to come back to you with a full assessment of the entire list, council member, if that's all right.
Do we have, I know I've had some conversations with shelter providers as well as in the PSH world about who should be prioritized, you know, the top of the list conversation versus the person who we might be able to get through fastest, and so keep that bed churning. I'm curious, one, if you have any thoughts about that, but two, might it behoove us to have kind of a certain shelter space that we dedicate to really moving people through, even if they're not at the top of the list, so that we can really start, making that bed very effective?
Sure. So this is a very active policy conversation. And let me give you a few perspectives. One is that, I mean, in some ways, the HEAL initiative is just that. We sort of say everybody that comes into the shelter has access to a housing resource. It may take us a while to get you housed, but you're not going to be just sitting waiting on a waiting list, right? And in terms of the prioritization, what I'll say is this. I think it's been important when we have a fairly robust resource, right? Deep subsidy and rental assistance and robust case management, whether that is time limited to, up to a year or 2 years or a few months, or it is ongoing in the case of permanent supportive housing, that we are targeting that resource to the people who have the most barriers to stability, and that but for those resources would very likely remain housed. What I think we need to do now, and I think we're beginning to see that, ECHO has made good progress in this space, is to say, yes, but if we don't also address the people who maybe just very recently have entered homelessness, who have lower barriers, what we see is that over time, as their length of homelessness increases, so do their barriers, right? You accumulate trauma and you likely have lost your job, et cetera. So I really think that we need to be working from both ends. And that is part of what our recommendation around making sure that we have diversion and rapid exit at all shelters is.
Okay, just two more things. So one thing I noticed you didn't mention, and I'm curious where this could fit in, or if you recommend against. I'd love to know your opinion on sanctioned camping as a tool in the shelter continuum.
Right. So generally when we've, I think, communicated with council around sanctioned camping, one of the things we have said is that should we as a community invest in that, we really ought to be looking at something like what is happening at Esperanza, right, that has hard-sided shelters, that has adequate restroom facilities, et cetera. That model, in my view, is basically a micro shelter. It's not just go camp there, right, which is what was there previously, and we had a lot of challenges. And so from my perspective, that kind of a model is certainly within the purview or within the scope of the beds that we've talked about here. I think we want to be really thoughtful about, should a model that is not sort of a traditional shelter, single structure model, just to ensure that the services and amenities are adequate on site.
Okay. Well, that's all I have. I really appreciate your work. I kind of leave us where I started us. I talked to someone yesterday who provides services in the district who said the number of people he's seen is by far the most he's ever dealing with, whether it's because of the heat, pulling people out of the woodwork, but that we are going to see our numbers continue to rise, and that doesn't necessarily mean we have more people. It could mean that they're just getting into the system, which is a positive thing. But we, especially in South Austin, need your help. Thank you.
Councilmember Allison Alter, then Councilmember Velasquez.
Thank you. Appreciate the presentation and all the information and the years of work here. I wanted to go back to the initial comments of the city manager about the need for us to really be bringing other partners in moving forward. And you mentioned that in the review of other systems that we were by far doing more in terms of our financial contributions than in other places. Can you speak to that a little bit more and also tell us how that information is being made available to our philanthropic potential partners? Because I think that's a missing link. I think we've been leaning into this, and so they assume we're going to do it, and they assume that's the way it should be, and that's the way a functioning system works, when in fact, from what we've seen, it's not. So if you could speak to that.
Right. So I will say that this is largely more of an observation as we've had discussions with our partners, developing say a percentage of private funding of a shelter system would take significantly more staff time, but it's something we might be able to look at. I'm going to editorialize a little bit here about how I think how we got here. One of the pieces is that we are a young city. We have grown incredibly rapidly. And while we are, I think, a prosperous city, because of our relative youth, our philanthropic sector is not as mature, or it is not as aged, if you will, as we see in some of our other Texas cities and other large cities. And so really part of that is just a historical investment of that philanthropic sector that has developed over time. As we began to build out our shelter system, I think we just did not quite have the level of support early on. And so I think it's just something that it's time for us as a community to have a conversation about, because on the philanthropic side, I think shelter is one of the easier ways for philanthropy and individuals to contribute to the system. I do want to be clear that we have substantial participation in other parts of our system from philanthropy, and other partners. But I think we can work in the report or in subsequent updates to council about what we see in terms of how we compare to other communities, because I think you're right, we need to share that with our partners.
And when we invested $100+ million of our ARPA money and the broader ARPA money that was not just our city-specific money into addressing homelessness, we challenged the county to do the same, which they have done, although it's been more in investments in permanent supportive housing than the other services. And then there was supposed to be another third that was private sector, and we have some individuals who've been working very hard on this with Finding Home ATX. But how much money for that philanthropic side have we successfully raised towards those goals?
So at our last report, and we will have an update relatively soon, 50 million roughly was the number for that effort. And I do want to also, I think it's important, when we are investing funds, it takes some time to do it with integrity in terms of having an RFP, et cetera. And so in our, I think in our June briefing, one of the things that we see is that we have substantial amounts of encumbered funds, but of the ARPA funds, we were only at about 12% spent down. So those dollars are now in contracts, largely being spent down, but we have not spent all of that money to date. We're in process still.
Thank you. And that leads me to my next question, which is about the marshalling yard funding, which is coming from ARPA funding, but that was not originally part of the plan. So can you speak to what we were going to fund but are not funding in order to invest in this shelter?
I can. So, and this has been provided in backup as well. But very briefly, I'm going to touch on the categories that we moved funds from within the ARPA investment plan. We moved $3 million from capital investment in permanent supportive housing, $100,000 from targeted prevention, about 2.5 from rapid rehousing, 3.2 from a variety of supports for providers, including capacity building, 3.5 from landlord engagement and move-in services, for furnishings, et cetera, and then 2.4 from some other services, and about 550 from system support, which funds a combination of city staff and outside contracts to support the process. So that's a lot, but we will have provided that in written format for council members.
And will the convention center be paid anything to use this space, and or will they contribute anything to these efforts beyond the space?
We do not right now, I'm looking to the manager, have an internal transfer scheduled, I don't believe.
At this point, that's not contemplated.
Great, thank you. And then you mentioned the rates of involuntary exit. Could you provide those numbers again? I think you might have provided that earlier.
So I didn't have a concrete number. I think that what we can look at is across the system. We're happy to provide that. We'll ask ECHO to help us pull those numbers.
Great, thank you. And the plan for the marshalling yard is 1 year? Is that correct?
Yes, sir. Yes, ma'am. Excuse me.
Okay, thank you.
Next up is Councilmember Velasquez, and then Councilmember Vela.
Thank you for the recognition, Mayor Pro Tem. Thank you. I echo everybody's thanks on your work with this monumental task. I wanted to echo also the concerns of my colleagues that there needs to be heavy consideration paid to gender safety at the marshalling yard. And then I have a few questions. Will shelter staff be adequately trained for mental health needs and trauma services?
So one of the requirements in the scope of work was that all staff be trained in trauma-informed care, de-escalation, and probably, I believe the third piece is mental health first aid. We can confirm that for you.
And we chatted earlier about the transportation. Will that also be available to transport to resources and appointments outside of the marshalling yard?
I think we'll have to talk with our vendor about sort of what the volume would look like. There are also other resources that can be used for that. So, through Medicaid, et cetera, sometimes we can use those. The other thing is that we can utilize Cap Metro's access program for people living with disabilities. And also from an operational standpoint, sometimes it's easier to give someone a taxi voucher or a ride share voucher so that they can do that. So we would anticipate that would be in the budget.
And so, this is proposed as temporary. What steps are being envisioned for long-term shelter capacity after the shelter closes?
Correct. So we shared with you three expansion sort of areas that are already underway for 245 beds. That is the expansion or the move to double occupancy at the two bridge shelters, as well as TUF's ongoing expansion of Esperanza. There are other potential projects in the community that are under discussion, led largely by our nonprofit partners. I think we're just going to have to see how those mature, and then if and how the city is involved in those efforts.
Okay. If the shelter stays open beyond the initial year and after our ARPA dollars runs out, is the expectation that the city will dip into the general fund to fund the shelter?
Councilmember, I think that's the question that we have not yet come to terms with. We used an enormous amount of the ARPA money for this effort. The general fund, if you were to transfer all those dollars and say now that it becomes a general fund responsibility, we would have a financial exercise to do about what we have to jettison so that we can afford to do this. So that'll be a policy discussion that's going to happen in 25, and I'm happy to watch it from home and see how you deal with that.
Thank you, Mr. City Manager. One more. If people are exited from the shelter, they'll stay in the Montopolis area. What control or oversight will the city have over both the referral process and exiting or shelter eviction process? And generally, how involved will city staff be with that?
So within the RFP and the anticipated contract, we've established that HSD will be in partnership with the vendor for the referral process. And then I would need to talk to staff to see whether there's anything explicit in the contract as currently contemplated around exit. I will say, I think we want to be good partners. If someone is exited and we have the opportunity to give them transportation somewhere, I hope that would be on the table. But these are citizens with the right to circulate in our community. So there's some limitation to sort of what happens guiding where people go should they leave shelter.
And Councilmember Velasquez, that's one of the, in terms of the introductory comments about creating a governance structure that's other agencies, I think as we are going to have to grapple with funding for dealing with the people who experience homelessness, and it's to develop our lane. So what is the appropriate City of Austin lane? That these are the things that we will do. And then let's work with our partners to figure out what lane they develop that they will do, that all is in unison toward an objective. One of the things that Councilmember Ryan Alter's questions caused me to think about that we don't spend enough attention, we have not devoted enough attention to, is what are the leading indicators for homelessness? And so when you talk to our innovation department, they've got their office, they have a lot of census tract data that you can delve into, and you know what neighborhoods are in danger of tipping over into having people in that neighborhood begin to experience homelessness because of poverty, lack of educational attainment, the unemployment rate among certain demographics. Those are all things we've got to start looking at up front, because those are investments that will pay long-term dividends for us if we do that right. And that way it'll keep people from experiencing homelessness altogether. So that we need to kind of look at the whole continuum. And I think that's going to be the exciting discussion as we really do this year, so we can lay that foundation for the recommendations for fiscal '25.
Thank you. Thank you.
Councilmember Vela.
It was Vela, and then I was going to add myself to the end of the list.
Very good. Councilmember Vela and then the Mayor Pro Tem.
I really appreciate the comments by the city manager right now on the core causes. Obviously, a very difficult and complex question. That said, in conversations that I've had around the issue, people point to mental health problems, point to substance abuse, but for example, West Virginia has plenty of substance abuse and mental health problems and almost no homelessness because their housing costs are so low that you can have a $200 little spot and survive basically with a roof over your head. And I don't think it's a coincidence that we've seen housing costs continue to escalate, and at the same time we've seen homelessness continue to escalate. And when I was with the point in time count and other kind of personal interactions that I've had with folks that are experiencing homelessness, they have income. And some of them have jobs, but there's no way they can scratch together, $1,000 deposit and $1,000 first month's rent and the Austin Energy deposit, and so they're just kind of stuck in this loop. So again, housing costs, which again we grapple with all the time on the dais, are just stand out to me as the number one, more than mental health problems, more than substance abuse. It's just can't afford a place, That's not what I wanted to say, though, but I did appreciate the comments. I just wanted to take a moment to highlight, I really appreciate the presentation, but, Casa Marianela, every time I see it on a list of kind of, homeless shelters, it always kind of, it doesn't quite sit right with me. I love Casa Marianela, and I just wanted to mention it for those that are not familiar with it. It's essentially an immigrant shelter for folks, refugees, people that are seeking asylum. The U.S. Immigration and Customs Enforcement frequently, and the Border Patrol as well, frequently will send folks that they're releasing, a list of resources. And if you're going to Austin, Casa Marianela is on that list. I saw 77 beds. I mean, they're way over that on any given, they are just, the managers are just so generous with their time, are just so good with their people. And I just wanted to take a moment to highlight the work that they do. These are not folks that were previously homeless, but they're folks that have gotten to the United States with like literally nothing in their pockets. They provide legal services to the immigrants. They will get them a work permit. And I would almost consider it like a cooperative because so many of the folks that are living and staying there are cooking, are cleaning, are repairing. It's a beautiful place. My partners, Jennifer Walker Gates and Jackie Watson, my old law partners, that was Casa Marinera, was our favorite nonprofit to donate to. Every year with the law firm, we would always support them as much as we possibly could. I know that it's not a widely known nonprofit as much as others, but it's a really, really great organization, and that provides a lot of service to our community. If not for them, I don't know what folks coming from, Mauritania or Cuba or wherever, would do, or where they would go. It just has helped so many people just get on their feet, get stable, and go on to become very productive and successful members of society. So I just wanted to highlight Casa Marinela, a great organization in Austin, Texas.
Thank you, Councilmember. Mayor Pro Tem.
Very well said. I was taking an interest to the statistic where you said people actually prefer to be in rooms with other folks. Can you talk a little bit about why people might like that? I kind of thought someone might want their own space, but it seems like they might like the sense of community
Sure.
more.
I think that one of the things that does happen in unsheltered encampments is that there is community there, right? Some folks, of course, may be unsheltered and live off by themselves, but in many cases there are communities that form. And so I think moving into a space in which you have your own room, and usually within shelter, folks aren't allowed to sort of visit between those rooms. And so people can feel isolated. And so that really was the primary thing we heard. But also, there is some, there are communities of care where if someone is having a health issue or something, they feel a bit safer having someone who is known with them that can kind of look out for them and help them manage some of those or alert someone if help is needed.
That's great to hear. And can you tell me a little bit more about when there's intake and folks have pets? Are there specific locations where unhoused individuals with pets can get linked up so that they don't have to be separated?
So this varies shelter by shelter. I will tell you the two that I'm certain, or actually I'll say three places I know that pets are allowed are at our two bridge shelters. We knew that was very important if we were going to have entire encampments come in, that many people wouldn't come without their pets, and there are quite a few of them. And then, of course, Esperanza allows for pets. But it is not always practical, but we just recognize that that relationship is very important to many Austinites, but particularly to people who are living unsheltered. And so if we want people in shelter, we need to make accommodations as much as possible.
I appreciate that because I think that companionship is really important as people make that transition. Can you talk a little bit about are there any increased costs for the infrastructure needs of those bridge shelters if they're going to be expanded from single occupancy to double occupancy? I know in years past we've talked about if there's any federal funding available, there's certain standards that have to be met. Can you talk a little bit about if there's any infrastructure needs for those?
So far, the sort of ramp-up costs in the bridge shelters has primarily been furnishings. So obviously additional beds, increased ability to secure items within the room if you're sharing the space with someone, and some privacy. So far, we have not had additional infrastructure needs to the Capitol facility itself, and we have identified one-time funds that we could use to get those shelters set up for double occupancy.
Mm-hmm. That's great to hear because I know we've seen great success with the HEAL initiative. I know it takes a long time to plan to get some of those individuals censused and understand their needs and to be able to actually transition folks from an encampment into having a door to lock and a roof over their head. And so I appreciate all of the innovative strategies that y'all have been using to try to do these as quickly as possible. I know folks get really eager to see a lot of, HEAL initiatives happen faster, but the truth is they can take months of planning to really understand the needs and make sure that people are getting the services that they need once they're able to transition into housing. So I really appreciate the work that y'all are doing on that initiative. And while we're on the topic of giving shout outs to some of our favorite community members that are working in this space. I know we've mentioned the Other Ones Foundation a number of times. We were fortunate to have them start in District 8, and now obviously they're serving folks in their location on the east side. But they also have an innovative work program, the Workforce First, which I think is a really good step in getting people into some sort of steady income as they're capable and able to do that. And so we think they're great partners and appreciate anyone who's working in this space on the public, private, or nonprofit or just volunteer side of this. I know there's a lot of folks working on this issue together.
Indeed.
Thanks.
Thank you. And I will mention, I'm glad you mentioned HEAL and the bridge shelters. So we are talking generally about expansion of beds, but really critically at the bridge shelters, almost doubling the beds ought to mean we're able to really increase the pace with which we address whole encampments. And so we're really excited about seeing more encampments addressed in that way.
Councilmember Bailey.
One more question. I was at a conference last week. One of the seminars was about heat-ready cities and emergency shelter. And the presenter mentioned that, in her view, there's a real opportunity for either homeless folks or formerly homeless folks to be the ones staffing and running kind of like emergency shelter operations. And she said it was just they know each other, they got the vibe, you know what I mean? They communicate in the same language, and it really just struck me as, because I know one of the reports when the auditor's report was like, the Parks and Rec staff, that's not the population they're used to dealing with, and they were really struggling with it.
Absolutely.
Any thoughts on that?
Yes, absolutely. And so I think in this sector overall, there has been an increasing focus on hiring people with lived experience and expertise in homelessness. We do ask those questions as a scoring item in our RFP. How are you not only hearing from people and influencing your program design, but are those people represented on your staff? I want to call out a couple of examples that immediately come to mind. One is that Urban Alchemy's employment model really leans on lived experience that's similar to the population, whether that be people who have lived experience of homelessness or, many people have had substantial interaction with the justice system. And so their staff often have had that experience as well. And I think it's been very important in establishing a positive environment at the Arch. Urban League also at Southbridge has been largely staffing with peers. So there's certification of a peer specialist, again, in homelessness, someone who's experienced significant behavioral health challenges, a reentry peer, et cetera. And so we see this throughout our system, but those are a couple of examples and something we will, I think, continue to promote.
Thank you.
Councilmember Harper Madison.
I'll be brief. Actually, it's a comment for you. I'd really like for us to eventually be able to revisit the work that you were doing on the Brain Health Institute. I think that's going to be a critical component in moving forward and us having some longevity in our addressing our homelessness situation.
I appreciate that and have reached, without giving too long a statement, I've already reached out and made some contacts, and I even made some notes while we were talking about this today as part of a follow-up. So thank you for that. All right. Oh, Councilmember Fuentes.
Thank you. This is a question for the city manager. Manager, it struck me that many of our comments today on the topic of the shelter plan presentation was around the marshaling yard. It's such a big contract. I know that a lot of us have constituents who are reaching out and have shared some questions and concerns, and I appreciate the info page, which has lots of FAQs on it, but when can we expect the backup material for item 111?
So I believe backup has been provided, but there is ongoing Q&A, and so we've been, given varying sort of target timelines from the clerk's office, and we'll be answering those over the course of a couple days.
Get out what you've got, and then do a supplemental. I mean, if you have backup, send it out. I mean, if there's additional Q&A, we can continue to add to, if that's the question.
We'll look at that. I believe the fundamental backup to be there, but we'll make sure that we're adding to it.
Okay, and so by being there, it'll be posted to the agenda website, or is that emailed via?
Yeah, just a normal process.
Okay.
So let's talk to make sure I understand what you are not seeing there to make sure we're meeting your needs.
Okay, thank you.
Thank you. All right, members, that takes up the briefing. The next thing we're going to do is